Miss Nora. I'm your aide for today. My name is Sophia, and I'm here to give you a shower. Do you want me to give you a shower today? Is that okay? And Miss Nora said yes. So Miss Nora, I'm gonna go gather my supplies, and I'll be right back. Okay? Miss Nora, I have my supplies, and I have here 2 towels, 3 wash rags, I have your soap, and I have the shampoo that you love. Give me a few minutes. Let me go and check your care plan, okay? Okay, Miss Nora, I just reviewed your care plan, and I'm going to go back outside to wash my hands and get my gloves. Hi, Miss Nora. I'm your aide for today. My name is Sophia, and I'm here to give you a shower. Do you want me to give you a shower today? Is that okay? And Miss Nora said yes. So Miss Nora, I'm gonna go gather my supplies, and I'll be right back. Okay? Miss Nora, I have my supplies, and I have here 2 towels, 3 wash rags, I have your soap, and I have the shampoo that you love. Give me a few minutes. Let me go and check your care plan, okay? Okay, Miss Nora, I just reviewed your care plan, and I'm going to go back outside to wash my hands and get my gloves. Okay, Miss Nora, my hands are clean. I just washed my hands, so I'm going to apply my gloves, and then we're going to get you in the wheelchair, okay? So how are you doing today? That's wonderful. That's what I like to hear. And my clients are happy. So I have the wheelchair here, and I make sure the brakes are locked. Okay, Miss Nora, I'm going to lower the railings on your bed, and I'm going to help you to sit up, okay? So I'm taking the covers off. And Miss Nora, I'm going to swing your legs to the side of the bed. Count 1, 2, 3. Okay. Now, Miss Nora, I want you to put your arms around my neck, and that will help you to sit up, okay? Now we're going to sit up at the count of 1, 2, 3, okay? Ready? 1, 2, 3. And there you go. Good job. Okay, Miss Nora, now that you're sitting up, we're going to help you in the chair, okay? So put your arms around my neck. And then I'm going to bring you to a standing position, and then I'll pivot you, and then you'll sit in the chair, okay? After 3, 1, 2, 3, and we're going to stand. There you go, Miss Nora. Good job. Now we're going to turn and sit in the chair. Okay, ready? After 3, 1, 2, 3. Now sit. Good job. Now we're going to take you to your bathroom, okay? Okay, Miss Nora, so now you're in the bathroom. I'm going to lock the chair and bring your supplies. Now here's all your supplies, okay, Miss Nora? Now we're going to push back the curtains, and we're going to get you onto your bath chair, okay, Miss Nora? Hi, Miss Nora. Now we're here in the bathroom. You're gonna sit on your bath chair, so I'm gonna help you to stand. So we're gonna make sure your chair is locked. Okay, put your arms around my neck. And I'm gonna help you stand at a count of 3, and then we're gonna pivot over to your chair, okay? Ready? 1, 2, 3. Good job, Miss Nora. Now we're gonna turn, and you're gonna sit in the chair. Okay, so now let me help you to get on. Let me pull the curtain for privacy. Let me pull the curtain for privacy. And then I'm going to help you to get undressed, okay? So I'm going to use a towel so that you don't get cold. Okay, so let's take this arm out. All right, you can start it there. All right, she's now in the shower. She's getting ready to take a bath. So we're going to turn the shower on and make sure the water temperature is 115 degrees. First, we're going to test the water on our hands first. The water feels good. Now I'm going to ask Miss Nora to test it to see if she likes the temperature. Okay, Miss Nora says she likes the temperature. So the first thing we're going to do is wet the rag and have Miss Nora wash her face. Or if she cannot wash her own face, then we'll do it for her. So we're going to wash her on the eyes first. And rinse. Wash her on the other eye. Rinse. And then we're going to wash her on the forehead and the rest of the face. And rinse. And Miss Nora does not like to use soap. So all I did was just use the warm water with the wash rag. So you just check with your clients on their preference. Okay? So now we're gonna apply soap. Miss Nora likes the bar soap, so that's what we're using. So we lather the rag up for Miss Nora. And I'm gonna wash her back for her. And I'm gonna give Miss Nora, because she's independent, she can help herself. So I'm gonna give it to her and allow her to do as much for herself as possible. What she cannot do, then I'll help. So Miss Nora already washed the top of her chest, and I used the water and I rinsed her. So now I'm gonna help her with her feet because that's the part that she cannot do. So I soap up the rag and I soap up the feet. Make sure the feet are clean. And when you're washing the feet, just check our toes to make sure there's no open sores, no cuts. If there is, then you're going to document and report it to the nurse. So Miss Nora's toes and feet looks okay. And I'm going to make sure I rinse between her toes properly. And rinse all the rest of her body. And everything is all clean. So now Miss Nora is going to come out of the shower, and I'm going to dry her with a towel first so she doesn't get cold when she comes out. So Miss Nora is all dry, and I'm going to get a clean towel and put around her. And then I'm going to take her back to her room, and then we're going to get Nora dressed for the day. Goodbye.